This is a separate sphenoid bone. The sphenoid bone is called so because it is wedged in between the bones of the skull. Generally, it looks like a bat or a bird, and it has wings. This is the lesser wing of the sphenoid, and this is the greater wing of the sphenoid, and this is the body of the sphenoid. We can see the sphenoid bone in different views of the skull. We can see it from the inside of the skull in the cranial cavity. We can see it from the side of the skull. We can see it at the base of the skull as well. And also we can see the parts of the bone through the orbit. So this is the body of the sphenoid. From the inside of the skull, we can see that the body is grooved here by the pituitary fossa. This is the dorsum celli, the sella torsica, dorsum celli, and the tuberculum celli here. And this is the optic groove. The optic canal is in fact a canal within the lesser wing of the sphenoid. The lesser wing of the sphenoid forms part of the floor of the anterior cranial fossa here, and its medial end is the anterior clinoid process. Between the greater wing and the lesser wing of the sphenoid is the superior orbital fissure, and within the greater wing of the sphenoid we can see the foramen rotundum, foramen ovale, and foramen spinosum. The greater wing of the sphenoid can be seen on the lateral view of the skull and the floor of the temporal fossa. Anteriorly, this is the foramen rotundum, and the foramen rotundum opens into the Pterygopalatine fossa. This is the region of the Pterygopalatine fossa. It's a hidden area in the skull. It can only be seen from the side in a fissure between the lateral pterygoid plate and the maxilla. So these are the other parts of the sphenoid bone. The medial pterygoid plate, which has a pterygoid hamulus inferiorly, scaphoid fossa superiorly, and this is the lateral pterygoid plate. Within the body of the sphenoid, these cavities are the sphenoidal sinuses, and they are separated by a septum. Usually the septum is off the midline. And this is the basisphenoid, which articulates with the basiocciput, and this articulation fuses at about 15 years of age. The sphenoid has a spine, which can be seen in the infratemporal fossa. This is the spine of the sphenoid, foramen spinosum and foramen ovale. This is again to show you the different views of the sphenoid bone. On the lateral side of the skull, we can see the greater wing of the sphenoid participating in the formation of the region of the pterion and the floor of the temporal fossa. And here you can see the lateral pterygoid plate, and between it and the maxilla, this is the pterygomaxillary fissure that leads into the Pterygopalatine fossa. Now this is a view of the sphenoid bone from within the orbit. You can see the greater wing of the sphenoid, lesser wing of the sphenoid. In between is the superior orbital fissure leading into the middle cranial fossa, and there is an opening within the lesser wing of the sphenoid, and this is the optic canal. On the base of the skull, we can see again the sphenoid bone, the lateral pterygoid plate, medial pterygoid plate, and this flange of bone in between them is in fact forming the posterior wall of the Pterygopalatine fossa. The medial pterygoid plate has a pterygoid hamulus and scaphoid fossa here, and this is the body of the sphenoid bone forming the basisphenoid here. Again, you can see the greater wing of the sphenoid. Here it forms part of the floor of the infratemporal fossa, and it carries foramen ovale, foramen spinosum, which is related to the spine of the sphenoid.